For millions of men over the age of 50, the frustration of waking up multiple times during the night to urinate isn't just a nuisance, it's a health concern. This condition, known as nocturia, often signals underlying issues like an enlarged prostate, reduced bladder capacity, or hormonal imbalances. It disrupts sleep, diminishes energy during the day, and over time, can increase the risk of falls, cognitive decline, and even heart disease due to chronic sleep deprivation. But here's the good news. A growing body of scientific research points to a specific nutritional deficiency that could be playing a silent role in this nighttime struggle. And today, we're diving deep into what may be the single most important vitamin for senior men who want to support prostate health and finally enjoy uninterrupted sleep. In this comprehensive health guide, we'll explore the vitamin in question, including how it affects the prostate, urinary function, and hormone balance, and we'll also uncover 6 other essential nutrients that work synergistically to improve urinary flow, shrink an enlarged prostate, and reduce nocturia. All of this is backed by science. No gimmicks, no speculation, only facts. If you're serious about taking control of your health, start by subscribing to this channel for more evidence-based content like this. And if you've personally struggled with frequent nighttime urination, share your story in the comments below. Your insights could help someone else on the same journey. Let's begin. Let's start with the vitamin that researchers consistently highlight as critical for male urinary and prostate function: vitamin D3. Vitamin D3, also known as cholecalciferol, is the active form of vitamin D synthesized in the skin when exposed to sunlight. While it's commonly associated with bone strength and immune health, studies show a significant connection between vitamin D3 levels and prostate function, especially in men over 50. So how exactly does vitamin D3 help the prostate? Research has found that vitamin D3 helps regulate the proliferation of prostate cells. In men with benign prostatic hyperplasia, or BPH, which is the non-cancerous enlargement of the prostate gland, unregulated cellular growth leads to pressure on the urethra, reducing urinary flow and causing frequent urination, especially at night. Vitamin D3 appears to suppress this abnormal growth and reduce inflammation in the prostate tissue. In a 2014 study published in BMC Urology, men with BPH who were given vitamin D supplementation showed significant improvements in urinary symptoms over a 12-month period. The researchers concluded that vitamin D's anti-inflammatory and anti-proliferative effects may offer long-term benefits for prostate health. What's the optimal dosage for senior men? According to the Endocrine Society, older adults typically need between 1,500 to 2,000 IU of vitamin D3 daily to maintain adequate serum levels, especially if they have limited sun exposure. However, those with severe deficiency or absorption issues may require more, under medical supervision. And why is vitamin D3 better than D2? While both forms raise vitamin D levels in the blood, D3 has been shown to be more effective in maintaining those levels over time. D2, or ergocalciferol, is plant-derived and less stable during storage and metabolism. D3, on the other hand, is more bioavailable, longer-lasting, and the preferred form for therapeutic use. In terms of urinary flow and BPH, the benefit of D3 isn't just theoretical. It modulates the expression of genes involved in hormone regulation, such as those controlling dihydrotestosterone, or DHT, which plays a key role in prostate enlargement. By helping to balance hormone levels and reduce inflammation, vitamin D3 can significantly improve nighttime urination patterns in older men. Now let's move on to another unsung hero in prostate health: zinc. Zinc is a trace mineral found in every cell of the body, but the prostate contains one of the highest concentrations. It's essential for testosterone production, enzyme function, and immune defense. But when it comes to the prostate specifically, zinc plays a crucial regulatory role. So how does zinc help with an enlarged prostate? Zinc appears to directly inhibit the conversion of testosterone into DHT, the more potent androgen that fuels prostate growth. In fact, studies have shown that men with BPH or prostate inflammation often have significantly lower levels of zinc in their prostate tissue compared to healthy men. One study in the Journal of Nutrition found that high zinc intake was associated with a reduced risk of BPH and better urinary flow scores. In addition to hormonal modulation, zinc is a powerful antioxidant and anti-inflammatory agent. It helps protect the prostate from oxidative damage and cellular stress, both of which can contribute to tissue swelling and dysfunction. What's the recommended dosage? For men over 50, a daily intake of around 11 milligrams of zinc is considered sufficient by the National Institutes of Health. However, therapeutic levels for prostate health often range between 15 to 30 milligrams daily, especially if taken in the form of zinc citrate or picolinate, which are more bioavailable. A word of caution: excessive zinc intake, especially above 40 milligrams per day, over long periods can lead to copper deficiency and immune suppression. That's why balance and proper formulation are critical. When paired with vitamin D3, zinc enhances immune surveillance and reduces systemic inflammation, making it a powerful ally in restoring normal urinary function and reducing those nightly wake-ups. Next, let's talk about saw palmetto extract. Saw palmetto, derived from the berries of the Serenoa repens plant, has been used in traditional medicine for centuries to treat urinary issues in aging men. Today, it's one of the most studied and widely used natural remedies for BPH. But how does it work? Saw palmetto acts as a natural 5-alpha reductase inhibitor, the same enzyme targeted by medications like finasteride. This enzyme converts testosterone into DHT, which promotes prostate growth. By reducing DHT levels locally within the prostate, saw palmetto helps shrink the gland and ease the pressure on the bladder and urethra. A 2012 meta-analysis published in Cochrane Database of Systematic Reviews evaluated 32 clinical trials and concluded that saw palmetto extract was more effective than placebo in improving urinary symptoms and flow rates in men with BPH. For men suffering from nocturia, the benefit is clear. Less prostate swelling means less frequent trips to the bathroom during the night. What's the ideal dose? Most clinical studies use 320 milligrams of standardized saw palmetto extract daily, often divided into 2 doses. The extract should be standardized to contain 85 to 95% fatty acids and sterols, which are the active compounds responsible for its effects. Compared to synthetic medications, saw palmetto is well tolerated and associated with fewer side effects. When combined with vitamin D3 and zinc, it provides a multifaceted approach to prostate care, addressing hormonal, structural, and inflammatory components all at once. But the puzzle isn't complete without addressing circulation, and that brings us to lycopene. Lycopene is a powerful antioxidant found primarily in tomatoes, watermelon, and pink grapefruit. It belongs to the carotenoid family and is known for its deep red pigment. More importantly, lycopene accumulates preferentially in the prostate and is associated with reduced prostate volume and improved urinary outcomes. Studies show that lycopene neutralizes free radicals and downregulates inflammatory markers in the prostate, helping to preserve cellular integrity and reduce oxidative stress, a major contributor to BPH. In a 2008 clinical trial published in British Journal of Urology International, men with BPH who took 15 milligrams of lycopene daily for 6 months experienced a significant reduction in prostate size and improved urinary flow scores. For senior men, this can mean fewer urgent urges and longer sleep periods without disruption. To enhance absorption, lycopene should be consumed with a fat source, since it's a fat-soluble compound. Cooked tomato products like tomato paste or sauce offer better bioavailability than raw tomatoes. And what's the ideal intake? Therapeutic doses range from 10 to 30 milligrams daily. Consistent intake over time has shown cumulative benefits, especially when combined with other anti-inflammatory and antioxidant nutrients. With lycopene added to your daily regimen, you're building a long-term shield for your prostate, one that not only helps reduce BPH symptoms, but may also contribute to a lower risk of prostate cancer. Continuing our in-depth exploration into the most effective nutrients for prostate health and nighttime urinary relief, we now turn to a mineral that often flies under the radar, yet plays a vital role in smooth muscle relaxation and bladder control: magnesium. Magnesium is involved in over 300 enzymatic reactions in the body, many of which directly influence muscle tone, nerve transmission, and inflammatory balance. In the context of prostate health and urinary function, magnesium's calming effect on the muscles of the bladder and urethra can help reduce the sensation of urgency, frequency, and spasms, particularly during the night. So how does magnesium support urinary flow and reduce nocturia? One key mechanism is through its ability to relax the detrusor muscle, the muscle responsible for contracting the bladder. In older adults, overactivity of this muscle often leads to the sudden urge to urinate, even when the bladder isn't full. This is especially common at night and is a defining feature of nocturia. By modulating nerve impulses and calcium signaling in muscle cells, magnesium helps ease this overactivity. Additionally, magnesium helps regulate inflammation and oxidative stress in the prostate gland. In men with BPH, chronic low-grade inflammation contributes to glandular enlargement and increased urinary resistance. By restoring magnesium levels, these effects can be mitigated over time. A 2016 study published in Lower Urinary Tract Symptoms found that men with higher dietary magnesium intake had a significantly reduced risk of lower urinary tract symptoms and fewer nighttime awakenings. What about dosage? The recommended daily allowance for men over 50 is 420 mg, but many older adults fall short due to poor dietary intake, certain medications, or decreased absorption. Supplementation with magnesium citrate or glycinate, both highly bioavailable forms, can help fill this gap. However, those with kidney disease should consult a physician before starting magnesium, as impaired renal function can affect magnesium clearance. Magnesium works especially well when paired with zinc, as the two minerals complement each other's role in hormonal balance and cellular protection. Next, we move on to a category of nutrients known for their profound anti-inflammatory effects: omega-3 fatty acids. Found abundantly in fatty fish like salmon, mackerel, and sardines, as well as in flax seeds and walnuts, omega-3s are essential polyunsaturated fats that play a central role in immune modulation, cardiovascular health, and, as emerging evidence suggests, prostate health. But how do omega-3s help the prostate and urinary system? Omega-3s, particularly EPA and DHA, inhibit the production of pro-inflammatory cytokines and prostaglandins. In men with BPH or chronic prostatitis, inflammation is a central mechanism driving gland enlargement, pain, and urinary obstruction. By reducing inflammation at the cellular level, omega-3s help decrease swelling, promote better urine flow, and relieve discomfort. A 2013 study published in the American Journal of Clinical Nutrition found that higher blood levels of omega-3s were associated with a lower incidence of prostate enlargement and fewer urinary symptoms in aging men. These fatty acids also support the flexibility of cell membranes, including those in the bladder and urethral lining. This may help reduce irritability of the urinary tract, which is often a cause of nocturnal urgency. What's the optimal intake? Experts recommend at least 1,000 milligrams of combined EPA and DHA per day for anti-inflammatory benefits. While this can be achieved through diet alone, high-quality fish oil supplements can help ensure consistency, especially for those with limited seafood intake. For best results, look for molecularly distilled fish oil that's tested for purity and heavy metals. Now let's highlight an amino acid that's quietly helping men sleep through the night: beta-sitosterol. Beta-sitosterol is a plant-derived compound classified as a phytosterol. Structurally similar to cholesterol, it competes with cholesterol for absorption in the digestive tract, but its most impressive effects are seen in the prostate. How does beta-sitosterol help with BPH and urinary flow? This compound exerts multiple effects. It reduces inflammation in prostate tissue, improves urinary stream strength, and increases the volume of urine released per void. More importantly, it has been shown in clinical trials to significantly decrease the number of nighttime urination events. In one double-blind, placebo-controlled study published in The Lancet, men who took 60 to 130 milligrams of beta-sitosterol daily experienced improvements in urinary flow rate and a notable reduction in post-void residual volume, meaning their bladders emptied more completely. This alone can reduce nighttime awakenings by minimizing the urgency caused by residual urine buildup. Unlike medications that come with side effects like sexual dysfunction or dizziness, beta-sitosterol has an excellent safety profile and can be taken long-term. The typical dosage used in studies ranges from 60 to 130 milligrams per day, often as part of a complex containing other sterols like campesterol and stigmasterol. Now, let's bring into focus another key player in the health of the prostate and bladder: Pygeum africanum. Extracted from the bark of the African plum tree, Pygeum has been used for decades in European urology clinics to manage symptoms of BPH and prostatitis. Its mechanisms are broad, including anti-inflammatory, anti-proliferative, and estrogen-modulating effects. How does it help with nocturia? Pygeum works by reducing prostate swelling and improving bladder contractility. It also increases the elasticity of the bladder wall, which allows the bladder to hold more urine comfortably, delaying the urge to void during the night. In a comprehensive meta-analysis of 18 randomized trials involving over 1,500 men, Pygeum extract significantly improved urinary frequency, flow rate, and nighttime urgency. Notably, men taking Pygeum reported fewer episodes of waking to urinate at night, a critical factor in sleep quality. The standard dosage ranges from 100 to 200 milligrams per day, using an extract standardized to 14% triterpenes and 0.5% endocossanol. When combined with saw palmetto and beta-cytosterol, pygium enhances the overall anti-BPH synergy, addressing both structural enlargement and urinary sensitivity. Lastly, we can't ignore the crucial role of vitamin B6, a lesser-known but essential vitamin in the landscape of prostate support. Vitamin B6 is involved in neurotransmitter synthesis, hormone regulation, and fluid balance. It indirectly supports prostate health by modulating estrogen and prolactin, two hormones that, when elevated, can contribute to prostate inflammation and urinary dysfunction in aging men. More specifically, B6 helps inhibit the accumulation of dihydrotestosterone in the prostate, similar to the action of saw palmetto and zinc. This offers a second layer of hormonal regulation, helping slow the progression of gland enlargement. Additionally, B6 supports serotonin and GABA production, neurotransmitters that calm the nervous system and may reduce the overactivity of bladder signals at night. The ideal intake for men over 50 is 1.7 mg per day, though therapeutic doses for urinary issues can go up to 10 to 50 milligrams, under medical supervision. By including B6 alongside magnesium and omega-3s, you're not only targeting prostate size and inflammation, you're also addressing the nervous system signals that influence nocturia. Let's keep building on what we've learned so far. Now that we've explored the powerful roles of vitamin D3, zinc, saw palmetto, lycopene, magnesium, omega-3 fatty acids, beta-cytosterol, pygium africanum, and vitamin B6, it becomes clear that improving nighttime urinary symptoms in seniors isn't about relying on a single miracle nutrient, but rather optimizing a full spectrum of nutritional factors that work in harmony to reduce inflammation, balance hormones, and support proper urinary function. But before we summarize, let's take a closer look at how all of these nutrients interact in the body, especially in relation to nocturia, BPH, and urinary flow, the three central issues for most men over the age of 50. Benign prostatic hyperplasia, or BPH, is incredibly common, affecting up to 90% of men by age 85. It involves the non-cancerous growth of the prostate gland, which begins to enlarge naturally as testosterone levels decline with age and dihydrotestosterone, DHT, becomes more dominant. This growth gradually compresses the urethra, making it harder to fully empty the bladder and increasing the frequency and urgency of urination, particularly during the night. What many men don't realize is that this process is often fueled by chronic, low-grade inflammation, oxidative stress, and nutrient deficiencies, especially in vitamin D3 and zinc, both of which are frequently low in seniors due to limited sun exposure, poor absorption, or dietary changes. When these deficiencies go uncorrected, the prostate remains in a state of unchecked growth and irritation, triggering those repeated nighttime awakenings to urinate. Meanwhile, the bladder itself becomes more sensitive with age, particularly under the influence of inflammation or nervous system dysregulation. Magnesium, omega-3s, and vitamin B6 play a protective role here, calming the bladder, improving its capacity to hold urine, and reducing the false alarms that lead to nocturia. What's equally important is that nutrients like beta-cytosterol, saw palmetto, and pygium don't just manage symptoms. They actually address the root causes of urinary discomfort by shrinking the prostate, improving urine flow, and reducing residual volume. This last point is crucial, because when the bladder doesn't empty completely, it fills up again faster, even during sleep. Reducing this leftover urine means longer, deeper sleep and fewer interruptions. Lycopene and omega-3s act as cellular protectors, reducing oxidative damage that can make the prostate more vulnerable to inflammation and dysfunction. Lycopene, in particular, accumulates in prostate tissue and exerts a long-term protective effect that may even extend to reducing prostate cancer risk in some men. Now, let's step back and look at the bigger picture. When a man over 60 begins to supplement with the right forms and doses of these nutrients consistently, especially vitamin D3, the central nutrient in today's discussion, the cumulative effects can be profound. The prostate gland becomes less inflamed, reducing pressure on the bladder. Hormonal balance shifts toward a healthier testosterone to DHT ratio. The bladder muscle relaxes, reducing urgency and spasms. The urethra opens more fully, leading to stronger urinary flow and more complete emptying. Sleep improves, energy rebounds, and quality of life increases. It's a slow and steady process, not a quick fix, but one that offers real, lasting relief. Many men notice their first improvements within 4 to 6 weeks of daily supplementation, especially if they're also making lifestyle changes like reducing caffeine and alcohol intake in the evening, exercising regularly, and managing weight, all of which support urinary health and reduce nighttime urination frequency. Still, there's one more essential factor we haven't discussed yet, and that's consistency. No nutrient can help if it's taken irregularly or abandoned after a few weeks. The key is to establish a simple, sustainable routine. Whether that means taking a high-quality men's supplement formulated for prostate support, or building these nutrients into your diet through whole foods, what matters most is doing it every day. Let's do a quick recap of what we've learned so far. Vitamin D3 helps regulate hormone levels, reduce inflammation, and prevent prostate cell overgrowth. Zinc supports testosterone production, inhibits DHT, and protects prostate tissue. Saw palmetto naturally inhibits the enzyme that drives prostate enlargement. Lycopene offers antioxidant protection directly within the prostate. Magnesium relaxes the bladder and improves nerve muscle signaling. Omega-3s reduce systemic inflammation and support hormonal and cellular health. Beta-sitosterol improves urinary flow and reduces nighttime urgency. Pygeum africanum enhances bladder function and prostate resilience. Vitamin B6 supports hormone metabolism and nervous system balance. Together, these nutrients create a powerful foundation for restoring urinary comfort, reducing nocturia, and promoting healthy prostate aging. If you've made it this far, you're clearly someone who takes your health seriously, and that's exactly the kind of mindset it takes to make lasting changes. We hope this video has helped you understand not only what nutrients to focus on, but also why they work, how much to take, and how to integrate them into your life safely and effectively. If you've personally benefited from one of these nutrients, or if you've tried a combination that helped you sleep through the night, share your experience in the comments below. Your story could make a real difference for someone else watching this right now. Don't forget to like this video if you found it helpful, and subscribe to the channel for more deep, science-based guides on men's health, prostate care, and aging well. Thanks for watching, and here's to deeper sleep, better flow, and stronger health at every age.